Modifier 32 is used in case of mandated consultations or related services. Services related to mandated consultations or related services means a third party such as insurer or government agency specifically requires a service on a patient behalf. For example, a school requesting physical examination prior to participating in a sports program, or an insurer requests an independent evaluation of patient filling a workers' compensation claim. And an insurer seeks a second opinion on a patient's condition prior to authorizing further treatment. For example, a cardiologist determines that the patient needs a mitral valve replacement for mitral valve prolapse. However, patient has this condition for several years. Insurance company covers mitral valve repair also, but requires a second surgical consultation prior to surgery. In this case, the cardiologist who provides the second opinion should report his service with Modifier 32 to show that insurance company mandated this service and therefore should be covered. If we fail to report Modifier 32, which will result in denial because of duplication of services. Why? Another physician may have already provided this service. So, there is duplication of services and it will result in denial. So, the second physician who provides the second opinion should report service with Modifier 32. Do not use Modifier 32 if confirmatory consultations are requested by patient or patient's family. And we can't use Modifier 32 in case of consultation with another physician or the service is requested by another provider. And Medicare payers generally do not accept Modifier 32. Modifier 33 is used to indicate to the payer that the service is in accordance with UPSTF, US Preventive Service Task Force. Modifier 33 is used when primary purpose of service is delivery of evidence-based service. Evidence-based service means delivering care based on current scientific evidence. Example for EBP is revision of guidelines in addressing sudden infant death syndrome (SIDS). Previously, the baby had to lie on their stomach when they vomit or choke. But according to the recent research, babies should sleep on their back until they turn 1 year old. While appending Modifier 33, the payer should process the claim without a patient due balance and be sure to use a screening diagnosis, which can be used to indicate certain preventive services and immunizations. Modifier 33 was created in response to Patient Protection and Affordable Care Act (ACA), which requires the healthcare insurers to cover certain preventive services and immunization without cost sharing. That means patient cost sharing doesn't apply. The payer should process the claim without any due balance. So, in order to apply this modifier correctly, we should know which services are covered under ACA. Consider the four categories while appending Modifier 33. We should know which services are covered. First one is service rated A or B by UPSTF. Second one is preventive care and screening for children recommended by Bright Futures and newborn testing. Then preventive care and screening provider for women in comprehensive guidelines supported by HRSA. Then immunization for routine use in children, adolescents and adults as recommended by Advisory Committee on Immunization Practices. The covered immunization examples are Zostavax immunization in adults, inactivated poliovirus for children, hepatitis A and B, human papillomavirus, measles, mumps, rubella, influenza for both adults and children. Apply Modifier 33 for private payers only. CMS, Center for Medicare and Medicaid Services, do not recognize Modifier 33. When screening turned into a diagnostic procedure, for example, when screening colonoscopy turned into a polypectomy, we can apply Modifier 33 even though it is a recommended preventive service. In other words, we can use Modifier 33 in case of recommended preventive service. Then apply Modifier 33 to all eligible services. That means if multiple preventive services are provided on the same day for a non-Medicare patient, we can apply 33 to codes describing each preventive service rendered on that day. Then we can apply 33 when primary purpose of visit is a preventive service. Then when the recommended preventive service and office visits are billed separately, no need of Modifier 33. Then do not apply Modifier 33 for separately reported services specifically identified as preventive. For example, HCPCS Level 2 G codes for preventive services. G0202 screening mammography is an example. These are the code for preventive service itself. So, no need of separate adding Modifier 33. For example, screening mammography bilateral tube view 77057 is for non-Medicare patient. In these cases, along with this code, we cannot use Modifier 33 because it is a code for preventive service itself. And for Medicare patient, we can apply G0 series codes, G0202. If you found this video helpful, please do like, comment, share and subscribe. Thank you.